Hello, everyone. Thank you for joining us today. We hope you had a great 4th of July weekend. As you can see, we are unable to go live today. But if you have any questions regarding today's topics, feel free to reach out to us. My name is Ana Isdame, Health Promotion Specialist. And today we have Alicia Sanders and Sarah Blatchford joining us. Alicia is going to talk about lead and Sarah is going to talk about immunizations. Alicia, I know you've been here before and talked to us about food safety, but would you like to reintroduce yourself and let us know how long you've been with the health department?
Sure. Hi, I'm Alicia Sanders. I'm an environmental specialist with the Siouxland District Health Department. I've been with the health department since 2003.
Sarah, would you like to introduce
Sure.
yourself?
I am Sarah Blatchford. I'm a public health nurse. I have been here since 2005, so a little bit less than Alicia, but yeah.
So let's talk about lead first. Alicia, what is important to know about lead and how does it affect one's health and why is it dangerous?
Okay, so here at the Siouxland District Health Department, we work on the childhood lead poisoning prevention program, and we cover Woodbury County. One of the goals for childhood lead poisoning prevention is to educate about lead poisoning and what lead poisoning is. Here in the state of Iowa, children are lead poisoned. The number one cause of lead poisoning is lead-based paint. Typically, that is deteriorated paint in a child's home, a house they visit, whatever it may be, or it also could be lead-based paint that is on a chewable surface. So window sills, window ledges, different things like that. So yes, here in the state of Iowa, lead-based paint is the number one cause of lead poisoning.
So I know that in Woodbury County, specifically, testing for lead has always been pretty low. How do you work with parents to encourage lead testing?
Sure. So yeah, when parents call or question about lead, I work with them and encourage them, ask them, where does the child reside? If it's a home that was built before 1978, talking with them to encourage testing of lead poisoning more often, especially working with the child's physician or healthcare provider to encourage testing more often. Here in the state of Iowa, a child is required to have one lead test before entering kindergarten. But of course, we do want more lead tests if the child does reside in or regularly visit a home that was built before 1978, just because the risk of lead poisoning is so much higher.
Definitely. And what types of services does the health department offer in regards to lead?
Sure. So we do have a laboratory that does provide limited blood lead testing for kids who live in Woodbury County. Whenever there is a child that has a high venous blood lead test, we do follow up. Sarah and I both do. Sarah, as her role as a public health nurse, I follow up and inspect the home when it's at a certain level. There's very specific levels where we follow up on as required by Iowa code. And so we go in and myself and a coworker go in and investigate that home. And our main goal when we investigate that home is to determine where the lead hazards are and to educate the parent and to prevent lead poisoning from continuing.
Now, does someone need an appointment to come in and get tested for lead poisoning?
That's a good question. I don't think so. In our laboratory, if you can help with that, Sarah.
Yeah, I think they can just come into the lab and they will draw the finger poke and do the lead test.
Okay.
Yep.
Now, Alicia, is there anything else you would like to add or think the public should know in regards to lead testing?
Yeah. Like I said, and I can't reiterate this enough, is lead-based paint is the number one cause of lead poisoning in children here in the state of Iowa. So as long as we have homes that are built before 1978, that's when lead-based paint was banned. As long as we have homes that were built before 1978, there could be a potential where a child could be lead poisoned. So you really want to watch for that deteriorated lead-based paint. What it looks like is we call it an alligator type cracking is what it looks like. like. You want to keep your children away from that. You want to clean that. You want to use wet cleaning methods to clean that out. Some short-term controls would be to paint it over. But yes, please go to our website, SiouxLandDistrictHealth.org, search for lead, and that will have more information that can assist parents with lead-based paint prevention and to prevent lead poisoning.
Okay, awesome. Thank you very much. Let's move on to immunizations. So Sarah, can you tell us a little bit more about the immunizations we offer and who qualifies?
Yes, so we here at the health department have the VFC program, which is Vaccines for Children. There are a group of children who qualify for our immunizations. One would be they have Medicaid or Amerigroup or Iowa Total Care. Those children all qualify to see us for immunizations. If they have no insurance at all, if they're underinsured, so they have a primary insurance, it just doesn't cover vaccines. Native American or American Indian qualify no matter what. I think that's it. So if they have a provider who doesn't provide the VFC vaccine, they come to us. We have clinics twice a week. They call and schedule an appointment. So you have a time, come in, get the vaccines, and you're out. It doesn't usually take very long. And yeah.
And how do people schedule vaccines?
Just call us at 279-6119. We need to make sure we have their previous vaccinations so we can make sure they're up to date with what they need. So we would want all their historicals. We'll enter that into the Iowa database so they have a complete record in Iowa, and then we'll schedule their appointment.
So are there any walk-ins allowed, or do you prefer appointments?
We prefer appointments just because it takes some time to get their records in the database, check what they've had, and just to get them caught up. It is a process.
And the earlier they get them in, the better.
Yes.
Rather than later.
Yep. And if you call that week, we can usually get you in.
Okay.
It doesn't take too long.
So are there any pointers or tips you think would be good for parents to know on how to prepare their children for vaccines?
So right now it's July, so it's going to be back to school. I would recommend parents call us now. Clinics are not really busy in July. Once we hit August, you're going to have a harder time getting an appointment, and it's going to be a rush to have everybody vaccinated. So your kids 4 to 6 who are going into kindergarten, your 11 to 12-year-olds going into middle school, and your 16 to 18-year-olds are going to be seniors, all need required vaccines to start school. So those are the kids we want to see as soon as possible. We are going to have about 6 clinics in a 2-week time frame in August to try to get all those school kids scheduled. Starting in the fall, we will be doing Saturday clinics. So that will be something to look out for on our website. And just prepare your kids depending on how old they are. I don't want kids to think vaccines are a punishment. They are to keep them healthy. And prevent them from getting really, really sick. That's why we have vaccines. Prizes and support and clapping. We try to make it a positive experience and not such a bad experience for kids. Just educate them. They're smart little people, and the more they know, the better when they come and see us, and they're not so scared.
Definitely.
So, yeah.
Is there anything else you would like to add or think people should know about immunizations?
Nope, just back to school. Just everybody remember those ages, your kindergarten, your 7th grade, and your seniors. They do need to have vaccines. The school nurses will be calling you at home, and we will be going out to audit records starting in October at the schools. So just get everybody caught up.
Okay, awesome.
Yep.
Thank you very much. So that is all that we have for you today. Thank you again, Alicia and Sarah. We will be planning on going live again next month on August 2nd, and we will be talking about breastfeeding. So thank you, everyone. Have a great rest of your day. As always, if you have any other additional questions, comments, concerns, feel free to reach out to us.